And I slapped my arm down on the warmer and opened up my elbow area, my inner elbow, and I said, do it now.
Wow.
She was great. She got the things that were needed. She put a tourniquet on me. She attached me somehow with a big needle to my arm with a little tiny butterfly needle that she was able to get into the baby. I
Wow.
don't know how she did that
How did
because the
she find
baby was
a
bloated,
vein?
yeah.
Yeah.
And she said, "All right, let's do this." Hello there, welcome back to the Bleedin Truth. I'm Sally McNally and I'm here with my daughter Bridget.
Hello, that's me. And yeah, so we've started this podcast almost a month ago now for Sally to talk about her stories and share all sorts of info and experience on a lot of different women's health issues.
And today I'd like to talk about my bleeding truth about being a walking blood donor in Saudi Arabia.
Exciting stuff. So I've heard some of these stories, but I think there's probably more that I haven't heard. So I'm excited to hear some of these today. And before we hop into them, just want to say listener discretion is advised. A lot of the stories that Sally shares are sometimes gruesome or, just intended for mature audiences. So listen at your own discretion.
Right.
And also, before we get into it, we're going to answer a question from the listeners. And thanks again, you guys have really fantastic questions. We'll put a link again in the description for you guys to ask Sally anything, and we'll answer it on one of the future episodes. Anything about midwifery stuff or yoga or, Sally's personal stories, we'd be happy to dive into them as well. So the question, none of these are hard. I think,
Right.
you have so much experience that it's really cool that people want to ask you any question at all. So I mean, I see it as an honor.
It is an honor.
So the question for today, this is an anonymous question. They're asking, they're sharing a little bit as well. So they're saying, I have a new boyfriend and I've had quite a few gynecological and urinary problems since we've dated only 6 months ago. One thing after another. Yeast infection, spotting for 5 weeks, a UTI that won't go away. And now I just did the leap. So intercourse is off the table for 6 weeks. How can I do other things that are healthy and loving while my health gets better? And what can I do to keep the intimacy alive?
Well, you poor girl, it sounds very annoying because you're getting a yeast infection and UTIs. First of all, you've got to leave that area down there clean and dry, right? Yeast loves sugar.
Mm-hmm.
So look at your diet and reduce the amount of carbohydrates and sugar that you're eating. And if you're still making love after the leap, or maybe you're past that stage now where you can make love again, maybe think about what your partner's eating too. If his diet's full of alcohol or sugar or
Oh,
carbohydrates,
interesting.
then his sperm is going to be very sugary too. So
Oh,
that's going
wow.
to feed the sperm as well,
I didn't know that.
or feed the yeast. Yeah.
What
So
is LEAP? It's capitalized, it's an abbreviation, LEEP.
yeah, it's a procedure that when we do PAPs, we're looking for abnormal cells on the cervix,
Gotcha.
um, damage to the cervix that is caused by the HPV virus. And every now and then we find more damage. So there's different levels of damage that can occur. And sometimes biopsy is needed. Sometimes
Oh,
it's a
wow.
little biopsy and sometimes it's a deeper biopsy. And the leap is kind of like a cone shape. It goes in and takes like a little cone shape from the entrance of the cervix. But of course, it needs time to heal, and the 6 weeks is usually the time it takes.
Oh, okay.
Uh,
Gotcha.
Aha. So we would say don't have intercourse for that time because there might be spotting or, you might disturb the healing.
Mhm.
So, of course, there's many ways you can keep the intimacy alive. There's other ways of lovemaking that you could do, but also maybe to spend time developing the relationship itself. If he's a good man and he loves you, he's not going to worry about waiting for 6 weeks. That's a short amount of time. If he
Mhm.
can't wait for 6 weeks to make love to you, then maybe it's good to know that now, because later when you have a baby, that's the same time frame. After you have the baby, we usually
Oh,
say
okay.
try not to have intercourse for the 6 weeks until the placenta site is healed, the cervix is closed up, and the vagina is healed. So if he can't wait after a LEAP procedure, he may not be able to wait after you have a baby too. So you don't want to find out then, right?
I mean, yeah,
um,
not everything intimate has to be sex, right? So you can
right.
do really nice date nights and a lot of other, couples things that definitely can be considered intimate as well.
Yes, Bridgie,
Yeah.
you might be a bit of an expert on that more than me now.
I think we both are honestly not experts in this field.
No, definitely not. But the UTIs,
Yeah.
perhaps it's irritation around the urethra,
Hmm.
and perhaps there's, that when the tissue is irritated, any bacteria that's there can find its way easier up and cause a UTI.
Hmm.
So for a UTI, to prevent it, you want to drink lots of water. You want to maybe take some cranberry juice,
Hmm.
cranberry pills. There's Azo out there you can buy, and it'll help to prevent the spasms that happen that
Hmm.
cause the pain in that area. But of course, if it's a true UTI, you're probably going to need some antibiotics. So you want to go to your midwife, your obstetrician, and get, a UA, a urine sent to the lab to see what kind of an infection you might have.
Hmm.
But the main thing is when there's like recurrent problems, look and see what it is going on. Are you, sitting around in your workout clothes or a swimsuit
Yeah.
too long? You want to keep that area, honestly, fresh and dry.
Yeah.
And no underwear at night helps, and no underwear during the day helps too. So, yeah, underwear is usually a good thing to air everything out.
I think also, I mean, maybe this is pretty personal, but from my own experiences, I used to have, you remember this too, Mom. I used to have like
Yeah,
really frequent UTIs in the
yeah, I
past.
do remember.
And I had
Hmm.
one that was really awful. It became a kidney infection.
Yeah,
And I don't know if you remember, but I was like it was after a tonsil surgery too, so that was why I got it. I think I
yeah,
wasn't able to do much. I was bedridden
yeah,
basically because of, after recovering
yes,
from surgery.
yeah,
And I was finally feeling better
yeah,
someday, and I just didn't know what a UTI even was then, and it became like a kidney infection, and within like
yes.
30 minutes I was like fine to really really bad fever and like
Hmm.
really in pain in my
No,
back. Do you remember that?
I remember it was so bad. Poor
Yeah.
baby.
Yeah,
Yes.
that was rough. So yeah, the and both of those things are
Yeah.
awful. And I guess also
Yeah.
from personal experience, sometimes it could be, who your partner is, right? Because that was, I
Yeah.
think, partly also the issue in my case.
Mhm.
I had my former relationship, I had a lot of UTIs and like very recurring, and in current relationship there's been none. I haven't had any
Yeah.
any issues in the last couple years at all.
Right.
And I think
Mhm.
sometimes it has to do with just like cleanliness between,
Yeah.
your partner and stuff
Well,
as well.
cleanliness too. And I have met people who are allergic to their partner's sperm.
Oh wow.
That they have like a reaction every time they have sex with them. And sometimes we meet women who have, you know, um, minor UTIs every time they have sexual intercourse with their partner. And that could happen with one partner, but not with a different
Oh wow.
partner.
Okay.
Yeah. So it could be just that, you might be allergic to the sperm or something.
Is it like something in the sperm that you could be allergic to, or is it some possibly, like you were saying earlier, like something to do with their diet, that, if they're eating something that you're allergic to and it's kind of
Well, I
in
think
their
that might be two
fluids?
separate
Okay.
things. Like if you think of the sperm being really sugary,
Mhm.
It's feeding the yeast. The yeast love
Right.
that. They're sitting there in the vagina saying, "Oh, I hope she goes for that chocolate cake." Yeah. You know, and then there can also be like a bacteria in
Yeah.
there. And a lot of women experience BV or bacterial vaginosis,
Mhm.
where that's a different thing. The bacteria in there love when you have your period. They feed off the broken down old blood cells, or when you have intercourse, when they can feed off the sperm.
So
So
nasty.
I know. And then, but the difference with that would be an odor. And it's not so much nasty as annoying.
Yeah, yeah.
Some ladies just they need to like get rid of the bacteria before they return to their normal way of living.
Mhm.
And that could be an antibiotic into the vagina or an antibiotic by mouth. It's usually Flagyl. That lady that asked that question, she says she has a UTI and she also has a yeast infection. She should look for those two things. Does she have an odor when she has her period or when she makes love, when there's sperm in there? And it's an odor that's like, we call it an offensive odor or a foul odor, where you're like, oh, that doesn't smell right.
Mhm.
And of course, she'd have a lot more discharge. But not doesn't sound like anything to worry about. If he can wait for the 6 weeks to pass and then to just resume sexual intercourse, and just take it easy for the first few times to make sure she doesn't bleed.
Mhm. Is it true that, once you get a yeast infection or UTI, you're more, um, likely to get it again?
Some women seem to be, unfortunate in that way, that they get recurrent BV, recurrent UTI, recurrent yeast. Sometimes we see women coming in a few times a year, and then something happens, changes in their life, and they all of a sudden stop. Having these infections. Stress can also affect a lot that's going down in the
Mm,
vagina.
yeah.
It can stress your whole body, and we do see women having more infections when they're stressed. So it's not just keeping yourself physically fit, but also mentally calm, and to check every now and then throughout your day, what was I just thinking, and was that stress making my body tense and making my vagina unhappy.
Mhm. So interesting. Have you seen
Yeah.
a lot of those similar cases with, women in labor as well? Does it happen frequently sometimes when you're pregnant as well?
Women who are pregnant, the tissues get kind of puffed up a little bit
Mhm.
around the vagina and the urethra, and the membranes can be stretched a little bit so bacteria can pass over and get up in there easier.
Mhm.
And but around the time of having their baby, when they go into birth, we don't see that much of an increase in yeast or UTIs.
That's
It's
good.
like the vagina gets itself ready for the event.
Yeah.
It has, the cervix has like a little plug of mucus that keeps that bacteria away and out of the uterus. So the body's really intelligent, keeps itself safe.
Yeah. Well, thank you so much. That was a really good question.
But there's many tentacles to that question
Mhm.
too. I feel bad for the girl that she has to ask how to keep the intimacy going.
Mhm.
But that's the way, like young people and young relationships, and you're just trying to get to know someone, and then all of a sudden you can't make love to them. That's really hard.
Feel like there's also a lot of pressure for like maybe both sides, but on the girls' side too, to
Yeah,
keep up
yeah,
with the
yeah,
sex. So
yeah.
that can be,
Right,
you know, kind of a intimidating thing to like
right.
not be able to provide when really a long lasting relationship, the older I get, I see it's a lot more to do with just working together in companionship than
Yeah, right. I
the
agree.
the in the bed stuff.
I know, but then the in the bed stuff is so important in
Of
a
course,
new
yeah.
relationship, isn't it? And then she has the added stress that perhaps the biopsy and the LEAP procedure may have been done because of HPV virus.
Hmm.
And then she's wanting to make sure she's clear of that before she has unprotected sex. It's really hard for us to look at a man and say, oh, look at here. Here's this man with HPV virus, whereas a woman, we do the pap and we can find it, and there's a lot of people
So it's
walking
harder
around.
to find it for a guy?
Yeah, there really isn't like a test we can do.
Interesting.
Yeah.
What are the symptoms of it for a guy?
They don't have any symptoms. They don't
Oh,
get
wow.
cancer. They don't get cancer of their penis, but they can get, sometimes they can get little warts. We can look for
Hmm.
that. If there's like any little warts on their penis or anywhere around their genitals, that might be a clue.
Well, what would be your final words to them?
I would say, to if you really love this guy, tell him that, soon you'll be back to normal, and that you hope that he'll be able to wait that long. I hate even saying that because, he should be the one saying that to her. So I don't know. I'm not an emotional expert.
That's okay. Yeah. No, there's still a lot of things that I've learned just because of that question. So
Yeah.
thank you.
So thanks very much for that question. I'm really not the best person to be talking about intimacy and relationships. I've made plenty of mistakes in my own past, and I'll tell you about them in a future podcast.
Yeah, but that I think that was a great question nonetheless. So thank you.
Yeah.
And I guess that means it's time to get into learning about your days as a walking blood donor.
Yeah. So here in America, we can go and donate blood, right? And usually there's a bank of blood and whenever it's needed, it's right there. And people are very generous. Some people donate blood really often. And some people, sometimes they're just called and they donate blood. Well, I'm rhesus negative, blood type O negative, and that's the universal donor.
Hmm.
So there's about 8% of people have this type of blood, and we can donate to everybody. It's a very friendly kind of a blood to have. Everybody can have our blood, but we cannot have everybody's blood. We can only have O negative.
Oh, that's right.
Um,
Yeah.
yeah, I just wanted to talk about that a little bit. Like at home in Ireland, I used to donate blood quite a bit, and there was a place we used to go to donate blood that when you would give them a pint of blood, they would give you a pint of Guinness.
Oh my gosh.
So it was great fun, and that
That's a good
bank
motivator for Irish
was
people.
great. And they used to advertise Guinness on big billboards, and they still do. Guinness is good for you because it's got iron in it, right?
Hmm.
So you'd donate your blood, and they would donate a pint of Guinness back to you. So it was great fun. And sometimes, if you were still dizzy after you donated the first pint, um, then they would, or if you were still dizzy after donating and you drank your first pint, they would give you a second pint. So it was kind of like that.
Logic.
But I don't know if they still do that, but
I
that
hope
was
they do.
fun.
That's hilarious.
So funny. No shortage of blood there, let me tell you. But when I worked in Saudi, there was a great need for blood, especially in the area where I worked.
So where
Remember
was
now
it again in Saudi?
in
Jeddah.
Jeddah, Saudi Arabia, and I worked for the Saudi military. And the women that I delivered often came in very anemic. They would start out in labour very anemic. I
Oh
often
wow.
saw them coming in with the hemoglobin of 5 or 6, whereas we would love to see their hemoglobin 12, 13.
Dang.
So they would have like less than half of what we like to
Is that
see.
just because of their diets?
Maybe their diets, maybe the fact that they continuously have babies over and over.
Mm,
And sometimes they would, have like 10, 12 babies. That's honestly normal for their
yeah.
amount of babies. And they never got to recuperate afterwards.
Hmm.
And then perhaps at that time, taking iron in pregnancy wasn't something that they were
Mhm.
doing either.
So
Um,
when you're a donor, you've called it walking donor. What does it mean to be a walking donor?
well, it would mean that you would have your name on a list, that you have a certain blood type, like O negative, that you
Mhm.
could always donate. And then throughout your day, you might hear a call over the intercom in the hospital. We need blood. It could be in Arabic, we need blood. And the walking donor would then get excused from the job that they were doing and go to the blood bank and donate some blood. It
Oh,
could
wow.
be, yeah,
It's like
it
you're
could
on
be some.
call.
It could be something like a big motor traffic accident,
Mhm.
or somebody bleeding in the hospital, or a mother having a postpartum hemorrhage. And that's my focus really for this
Mhm.
part of the story. Like 100 years ago, the easiest way for a young woman to die was during childbirth, and
Mhm.
and sometimes that was because of postpartum hemorrhage. Like even nowadays, about 3 to 5% of all women are going to have a postpartum hemorrhage.
Mhm.
Sometimes it's not so much, and sometimes it's a lot. And in the developing countries, it's one of the ways a lot of young women will die.
So when in case somebody doesn't know what hemorrhaging means, could you explain that?
So hemorrhage is just another word for bleeding,
Mhm.
but hemorrhage usually means heavy bleeding.
Mhm.
A hemorrhage, when a woman has like a vaginal delivery, we often see maybe about 50 to 200 cc's of blood loss. If it's 1,000 cc's, she's having like a big hemorrhage. It's really
Wow.
serious. Her life could be threatened by that.
And how is it like caused? Sorry, I'm asking a lot of questions, but
No, it's great.
how is
Yeah.
it caused during labor, like inside?
Well, it's mostly about the placenta site.
Mhm.
If she bleeds before the baby's born, that's an antepartum hemorrhage. If the baby's born and then the placenta comes out and now she's bleeding, this is now a postpartum hemorrhage, and this is the one where we see it happens most often.
Gotcha.
And it's usually that the uterus now it's empty and it has to contract to close off the little blood vessels where that placenta was.
Mhm.
So often we give the patients some pitocin, which is a medication to make that happen. And the use of pitocin after the placenta is delivered has reduced the amount of hemorrhages like greatly. So it's
Mhm.
really good. Whereas we don't, like usually the placenta comes out 5 to 10, 15 minutes after. If it doesn't come out, say after an hour or so, we're going to go up after it and try to peel it off the wall. Or, sometimes the
Wow.
patient might have to go to the operating room with the obstetrician to deliver the placenta that way.
Is to peel it, is this by hand or is this with
Yes,
tools?
yeah, with your fingertips to
Wow.
catch the edge of the placenta and peel it off. Now, you would very rarely have to do that.
Yeah.
That's not a common thing, but that would be the first try to get it out. Because if you leave it in there and she's bleeding, you got to stop it, right? You got to stop that bleeding. Um, so over in Saudi Arabia, before I became a walking donor, I saw many women having major postpartum hemorrhages that come in,
Mm.
and if they lost 500 cc's and they've already got this really low blood count, they're in trouble.
Mhm.
But if they have the low blood count and then they have a big massive hemorrhage, then of course their life is at risk. And I did see a number of women die because of that.
Wow.
Yeah. And they died for different reasons. We couldn't stop the hemorrhage. We didn't have enough blood, couldn't get an IV, something simple as that, because she's in a collapsed state.
Oh, wow.
And we didn't have the medications, or we didn't have the inserts. They have these great ways of stopping a hemorrhage here, where they put a balloon up inside the
Oh,
uterus and
wow.
blow it up and put pressure on the bleeding side. It's
Wow.
such a great ideas that they have nowadays. But and in those days, now this is like 30 years ago, in a developing country, we had a beautiful hospital with all of the most amazing equipment and electronics, and
Mm-hmm.
but they didn't have the basic tools
Mm-hmm.
sometimes that we needed, or the know-how either. So anyway, this one particular woman always sticks in my mind. I think she was about 18 years old, and she was probably having her third or fourth baby. And she had the baby. She was put into the postpartum room. Everything was going great. And the postpartum room that we had was like a room with 4 beds. And there was a patient in each room. And they usually didn't talk much to each other. They wore their yashmaks and their scarves. And it was just like their little breast out while the baby was feeding on this breast. And that was the scene, like usually in each bed.
Mm-hmm.
They were quiet. They didn't chat, or, there wasn't like the laughter and chatter that you might hear here.
Mm-hmm.
Hopefully it's different nowadays over there, but this is my bleeding truth. She went to her postpartum bed, and the rest of us, we were on labor and delivery. And one of the girls said, "Sally, come quick, come quick. There's a patient bleeding." So I ran down, and this lady was on the floor of
Oh,
the
wow.
bathroom, and the whole place was like covered with blood.
Oh, man.
And she was completely unresponsive. I couldn't find her little body because there was all of these cloaks and dresses and underwear, and everything was soaked in blood.
Oh, my
And
God.
she was completely unresponsive. And then she was bleeding and bleeding, and we started like making the plan, get the IV going, get the meds in. Somebody stopped the hemorrhage because we knew it was probably the placenta site.
Mm-hmm.
And we tried everything. Right there on the bathroom floor, we were trying everything. And then she had a cardiac arrest. So we're doing cardiac massage, trying to give her oxygen with an ambu
What
bag.
happens when you have a cardiac arrest?
Your heart stops. It's an
Oh,
arrest.
yeah.
Yeah, it stops. Basically, she died.
Mm-hmm.
So we're continuing the resuscitation, and everybody's trying their best. And then somebody said, "Let's get her back up onto the bed." And I can remember we all got around her, and we're lifting her little lifeless body up onto the bed. And we were looking at each other, and we all knew she was gone. She had left that body. And I remember feeling so bad that if we could just get the vein, or if we could just get the meds in, if we could just start her heart again, if we could just get enough oxygen in, if we could just put enough pressure on that bleeding. But she had already bled out.
Oh, my
She'd been
God.
in the bathroom on her own, trying to work it out. Not be they were like humble and quiet, and
Yeah.
you know, she didn't have it in her to say, help me,
That's
until it was too
heartbreaking.
late. It was heartbreaking, Bridget, just
Yeah.
heartbreaking. And so I remember her name was Miriam. Miriam. It's like Miriam for us.
Mm-hmm.
I remembered that very day. I can remember looking down at myself covered in blood, and we all cried our hearts out. And we, we had our hand right up inside the uterus. I had my hand up, trying to like squeeze from through the abdomen,
Oh,
holding the top of the uterus, and my fist against, where I was hoping the placenta site would be. And I was squeezing the two together, and there was no blood coming out anymore. She had already bled out, and we could not save her life.
wow.
It was just very sad. And that was in a hospital, so you can
Yeah.
imagine what happens out there in the tents and stuff. So
That's a
that
really like hard thing to go through
yeah,
when
it was
that's
very dramatic. It
yeah.
was very sad. But I always remembered her, and I went that very next day down to the lab, and I said, "This is my blood type. Sign me up. I'm a walking donor. Call me
Oh,
anytime that I can help."
wow.
And a few times I remember them calling and saying, "We need blood now," and I was like, "Yay, I can do something." And I'd go and I'd donate my bit of blood, and I
Mm-hmm.
wouldn't like know who got it or why they needed it or anything. But I remembered this particular patient. And now we're switching to
Mhm.
a baby girl. She was still in her mother's uterus. And I remember the obstetrician, he was a Saudi obstetrician, and I was standing by the bedside, and he was doing an ultrasound, and he was just kind of like talking through the side of his mouth, not to the patient, not to me, just saying things like, this baby cannot survive, this baby's going to die, this baby is doomed to
Oh
die.
my gosh,
And
that's so negative and
it's so
hard, yeah.
sad. Yeah. And the poor lady was crying, and he didn't even look at her, and he said, there's nothing we can do. We will induce this baby, and there's nothing we can do.
What
It
was
will
wrong?
die.
What was the
Well, here's the thing. She had the same blood type as me. She had O rhesus negative,
mm,
and her baby had a different blood type. So the father had a different blood type,
mhm.
obviously. So the baby inherited the father's blood type, and this is a common scenario, of course, because remember, only 8% are going to have that O rhesus negative.
Mhm.
So the rest of the population, it's more likely your baby's going to be rhesus positive. So if there's any crossover of blood between the mother and the baby, the mother can build up antibodies against that O positive or rhesus positive baby. So the mother's blood thinks, oh, that's an alien blood, let's attack that.
Oh, wow.
Yeah. So sometimes if she fell or was in a car accident, or, even if the seatbelt gripped her tight, or, that would be a way that the bloods could cross over and mix.
Interesting.
Sometimes at delivery, when the baby's being born, that can happen too. And then the mother builds an antibody against her next baby, which could be rhesus positive.
Wild.
So we have this great medicine called Rogam. So whenever a young mom is falls or is in an accident, and we always want to know her blood type.
Mhm.
Sometimes if she has a little bleed, even in early pregnancy, or has a miscarriage or an abortion, we want to know that blood type, because if there's any way those bloods could cross, we want to give her that Rogam to coat the antibodies and neutralize them, so that the next baby or this baby does not get affected.
And that didn't exist back then, that
Well,
drug
it
or
did actually, it
okay.
did exist, yeah. But this woman was coming from the desert, full term pregnancy.
Mhm.
And when they did the ultrasound to see, what was going on, the baby was all bloated. The baby's liver was swollen, the spleen was swollen, the baby had fluid where they shouldn't have fluid, like their lungs were full of fluid, and
Oh,
their
wow.
whole body was all puffed and swollen, and it was very sad. So the doctor said this baby cannot survive. The baby's already got, what's known as rhesus incompatibility, and another name for what the baby had is hydrops fetalis. Any nurses listening to this will remember the picture from the books, of that swollen baby, it looks like it's incompatible with life when they get this hydrops. But that was 30 years ago. Hopefully, things are a lot different now in Saudi. So then I'm inducing this lady, right? I put the medicine in to try and get her into labor, but the baby's head is so swollen that it can't come through. And after many hours of contracting and the labor, the cervix is opening, but the baby's still high. Her membrane ruptures, and what comes down? Only the cord. The cord comes down in front of the baby's head.
Oh,
So we've been trained, of course, that when we get a cord prolapse, we have to push the baby's head up off that cord so that the baby can continue to have the flow of blood and oxygen while we do a cesarean section. And
mhm.
whoever finds that cord prolapse, they have to stay there pushing the head up off the cord until the baby's lifted out through the abdomen.
Mhm.
So, of course, that's what I do. I get in there and I push the baby's head up, and the baby's head feels very soft, right? It feels like marshmallow. And I'm like, oh, poor baby, that feels, like really swollen. And I'm shouting, cord prolapse, cord prolapse. And the same doctor comes in with a few nurses. And I said, we've got a cord prolapse. We need to go to the operating room. And he said, I told you, Sally, that baby cannot survive. That baby will die.
Wow.
And I said, please, please, we don't know that yet. She's, asking us to help her. Please, let's save the baby, or at least do our best. Let's do what we can do. And he said, this baby is doomed to die
Why
because of the
was he like
situation.
that? Did he just not have any experience or
Well, maybe he didn't have this experience before, but he was adamant first. And I looked at him and I used a few of my little words like inshallah, like please God, and marshallah, God is good, to like try to get him to please help the situation. And he gave in and he said okay. And we went to the operating
thank
room,
God.
and I had to be on the bottom of the gurney all the way down. And I think actually this was my very first cord prolapse that I remember.
Mm.
There's been a few since, but that one was very dramatic because we were doing it for a baby that supposedly couldn't survive. So we got into the operating room, we did the surgery, and I could feel the baby being lifted out of the abdomen and away from my hand. And I came out and I'm watching as they cut the cord and the baby gets put onto the warmer, right? So in the operating room, there's a warmer with a big light over it. And there's the NICU staff, the neonatal intensive care unit, and they're looking at this baby with their hands out by their sides and shaking their head like, what can we do? There's
Wow.
nothing we can do. But there's the little baby, and the baby's looking like a little marshmallow, right? All
Yeah.
swollen, but the baby's trying to breathe, the baby's taking some breaths.
Yeah.
So the girls, they took a little ambu bag and they were trying to help the baby. And I came over and I said, I'm a walking donor. What about some fresh whole blood? She looked over at the doctor and he was busy, finishing the surgery. And I slapped my arm down on the warmer and opened up my elbow area, my inner elbow, and I said, do it now. And um,
Wow.
so she was great. She got the things that were needed. She put a tourniquet on me. She attached me somehow with a big needle to my arm with a little tiny butterfly needle that she was able to get into the baby. I
Wow.
don't know how she did that
Yeah, how did
because the
she find
baby was
a
bloated.
vein?
Yeah.
Yeah.
And she said, all right, let's do this. And I was squeezing my arm, and we didn't even know if the blood was going in there, but
You couldn't see.
something was happening,
Yeah.
right? Something was happening. And now this baby needed a blood transfusion because the condition, the hydrops fetalis
Mhm.
that the baby was born with, they were just completely severely anemic. So I'm giving the baby a little blood transfusion.
Like
And then
directly from your arm straight into the baby.
right,
Wow.
directly into the baby. And I was talking to the baby saying, come on, baby, live. Come on, baby, you can live. And then I remember we stopped after, maybe 10 minutes because we didn't know how much I was giving him. We were just trying, to
Yeah.
save the baby. And the NICU nurse, she drew a big syringe with 10 cc's of my blood and took that with her to the NICU, and she was like all into it then with me.
Mhm. Good
Well,
honor.
yeah. So the baby got taken away, and then I had to go to a delivery, and I kind of like in my head I was thinking, baby probably not going to make it, but at least we tried,
Mhm.
right? We tried. But 2 days later, the girl said that lady with Reese's problem, she wants to see you. her baby's still alive.
Oh,
And I'm like, oh
wow.
my God, that poor baby. So I went into the room to see her. And Bridget, the baby was not swollen. The baby looked like almost normal. The baby
Wow.
had a good color. The baby was taking, milk from a bottle.
Wow.
I know. And I came in, and the patient said, Sally, come and meet your little sister. And she said, I want you to give her a name.
Oh my
And I
god.
was so excited. And she handed me the baby, and the baby was wide awake, looking straight at me. And I was like, this can't be the same child. It just can't. It was like a
Wow.
miracle. And I'm looking at the baby, and the baby's looking at me. And I said, I call you Miriam. And that
Oh,
just felt so good. It was so nice. And so I often thought about little Miriam, and it's my little sister, my little baby sister.
that's
And where
so
is she now?
sweet.
And if she's still alive, even
Yeah.
if she did make it, if she, who knows what happened down the line.
Mhm.
But she sure looked a lot better than the baby I, had left in the
Wow.
OR.
And
Yeah.
Miriam after the other lady. That's so sweet.
Yeah. 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 But they're just a few stories about
You
my bleeding
saved,
truth.
yeah, you saved his life or her life. That's
Yeah.
crazy. Would that be, to do a blood transfusion, would that be not allowed anymore? Would there be too much liability or risk? Or is
I
that
don't, over there in Saudi, they don't really bring the lawyer into the hospital as much. Like here, we have like a little pretend lawyer on our shoulder all the time, and everything we do, we're consulting with our little pretend
like,
lawyer,
are you gonna
asking
get
him,
sued for this?
yeah, like,
Yeah.
am I covered? Am I doing this correctly?
Mhm.
Is this all, the way I
For
should do it?
good reason.
And
Yeah.
that's for a good reason.
Yeah.
Exactly. That keeps patients safe.
But do you think if that situation happened here, like, could you freely do that and save their life, or would
It,
that
it
just,
wouldn't it wouldn't have to happen
I
here,
guess,
because
yeah,
they would have the fresh blood. They would,
that's true.
no, they would have picked that up way earlier. All the women's blood would have been tested. They would give her that Rogam shot at 28 weeks, around
Mm,
27, 28 weeks, just in case,
yeah,
and then they do ultrasounds and make sure that, the baby's fine. Yeah. I mean, that was just a rare, case.
but
But yeah,
amazing, yeah.
yeah,
That's so, like, I think it's just incredible that under that much amount of pressure and the pushback from the doctor as well, who's
right.
technically the
Yes,
superior, right?
yes.
And I admire you for not giving up and letting him make that call.
Yeah, thanks,
Yeah.
Bridget. He did come to me afterwards, and he said, "There's always something new to learn, isn't there?" And I was like,
Wow.
"Isn't there? We're all learning here."
Yeah.
You
Was he
know?
someone
Yeah.
that, like, was a respectable doctor?
Yeah.
Yeah.
Oh, yeah. They, being a doctor is like a really great thing over there. So
Mhm.
a lot of the wealthy, children will be sent off to colleges, and often it's Western colleges that come here.
Oh,
They go
really?
to
Okay.
Europe.
Cool.
Yeah. Uh huh. They go to places like Ireland and England, and
Mhm.
yeah, and then they bring that back to their country. And I'm sure it's a lot different
Mhm.
now. I mean, I would imagine at this stage it's more like here,
Yeah.
that they would have the fresh whole blood and whatever that baby would need.
Right.
Or, it would never have gotten to that stage.
Mhm.
Like hydrops fetalis, very rare. Nobody sees that anymore unless it's a developing country, as we call them.
Gotcha, gotcha. And for those really tough, times where you witnessed a woman die or not make it, how did you handle that personally?
Yeah, well, you always have a feeling like I could have done more. And I think that nurses carry that. I could have done more. What did I not do? What did I not see? That they do their best in the situation. Here, it doesn't matter here or any country, the nurses are doing their best in the situation. Think of it like this: nobody became a nurse to do a bad job. Something inside them calls them to the job because the
Hmm.
job sometimes is so hard.
Yeah.
You know, you got to have a real calling to do that work. So they get called to do the work, and then they bring their best intentions. But when a patient dies, they go home, that nurse, and they cry. They have the feeling, they have the guilt, they have the awful aching in their heart for a long time, sometimes for life. Like, look at me, I have patients in my memory bank, you
Hmm.
know,
Yeah.
and
Yeah.
that they'll always be there, always. So it's not, something that, and I often feel, those poor nurses who had to work in the COVID units
Oh,
and the
yeah.
ICUs
Yeah.
over the pandemic, what they're carrying now, it's horrific. It's just because, for the first, year, they were probably like, what could I have done more? What did I not do? But then it's like, there's nothing I can do. They just know it, and it it must be really hard. They have so much on their heart.
But they're heroes too for being there.
Absolute. Yeah.
Yeah.
Absolutely.
Yeah.
Yeah. Yeah. I know a few from our own hospital, and I want to check their back. I want to check in under their clothes to see if there's wings in there,
Oh.
because they're like walking angels.
Yeah. And I mean, I think this is how I envision you, because you have had a really long career, over 40 years of working in women's health and labor rooms and learning so much through those years that now you are a really good teacher for all
Aw.
those things. And,
Oh,
now you
thanks.
can slowly transition into your next era of sharing all of that you've learned from experience.
Thanks, Bridget. Thank you, love.
Aw.
Well, maybe that's enough bleeding truth for today, huh?
Yeah, I think that was a great episode. Also, another thing I wanted to mention is that Sally was just talking about cord prolapse, and she has another great video talking about it on her YouTube channel for her yoga and childbirth education stuff. So I'll also link the cord prolapse video that she's made down in the description as well.
And I just wanted to mention something too for you COVID nurses who've had to deal with all of that trauma and the stuff that you're carrying. Being a hypnotherapist, I have developed a little script that might help you, just a little guided imagery.
Mm.
You might have a listen to that. It's called Let It Go.
Yeah, yeah. I'll also put that in the description. So we're gonna have a hefty description that you guys are gonna have to listen to or read. Awesome. Thank you for you guys' questions and for supporting Sally and always, giving us a thumbs up. Make sure on this episode you guys hit subscribe and share it with all your friends. Make sure that you're not missing any upcoming podcasts as well.
Yeah, thanks a million for listening, cheering us on. It's great fun. We're really, excited about future episodes and stuff. But just get your friends to maybe subscribe and have a listen, and maybe they like it. Who knows?
We're going to have a lot more crazy stories. We'll share some of those intimacy screw ups as well as those work stories. But also, just want to say shout out to anchor.fm. That is the recording studio that we are using virtually to meet, because I'm living up in NorCal right now. Sally's in SoCal. So this is how we're getting to record, and it's really good quality for podcasts or anything else like that. So if you have any need for it, you can check out. We have a link for that also in the description below.
Great. Thanks a million.
Thanks a million. Have a wonderful night or day or whatever.
Bye.